morning, APOSI peeps! Welcome back to our Wednesday Wellness webinar. Our topic for today is all about Zika virus, another disease caused by mosquito bite. It is a significant topic, especially to those at risk. It may not lead to death, but it can cause irreversible effect. As we go through to our discussion, we will be aware and knowledgeable about Zika. This is the highlights of our topic for today: the definition, mode of transmission, signs and symptoms, risk factor, diagnosis, prevention, and treatment. Let's talk about Zika virus. Member of the virus family, Flaviviridae, same as the virus cause dengue and chikungunya. It is spread by daytime active Aedes mosquitoes such as Aedes aegypti and Aedes albopictus. Its name comes from the Zika forest of Uganda, where the virus was first isolated in 1947. Here in the Philippines, merong cases na rin po ng Zika but hindi siya nag-outbreak. Na-control naman siya, and way back mga 1954, first sightings ng Zika is sa monkey pa lang siya. Then through the years, mga after 10 years, meron na pong na-detect na meron na din sa human. Maybe due to there are some people na tourists na mahilig mag-mountain climbing na na-infect ng active mosquito na merong carrier siya ng Zika virus. Here are the mode of transmission. This is the difference na makikita natin dun sa, kung compare natin siya sa dengue and sa chikungunya. Zika virus has a 3 types ng transmission, but primarily si mosquito talaga yung nagkokos. Once na nakagat ng mosquitoes, unlike sa dengue and chikungunya, yung infected na tao, pwede niyang maipasa sa another person. So, hindi lang po si mosquito yung pwedeng makapag-transfer. So, as you can see here in the diagram or sa picture, first, yun nga, sa monkey pa lang siya nakita. Then after a years, na-detect na siya sa human. Yun, then from the bite of mosquito, na-infect si person na nakagat. Meron dito na from a pregnant woman to her fetus. So si mosquito, nakagat niya or na-bite niya si pregnant women in her early trimester. So possible po na mapass through niya to sa kanyang baby or dun sa fetus. Mas mataas po ang transmission rate kapag nasa early stage pa lang po ng pregnancy. So kailangan po mag-ingat ang mga pregnant women kasi meron siyang irreversible effect sa fetus. Pwede siyang mag-cause ng microcephaly, which is the abnormal size ng head ng baby, na small talaga siya. Hindi na to nako-cure kasi as is na po siya. Pwede rin po siyang makapag-cause ng Guillain-Barré syndrome, which is a rare case or a rare disease na is an autoimmune disease siya, which is ang target niya is the nerve. So possible na mag-lead po siya ng paralysis. Then meron po tayo na transmission through sex. Yun nga po yung nasabi ko kanina, na once na nakagat ng mosquito yung isang tao, then hindi niya alam na infected na siya, nakipag-sex siya without protection, using condom, like that yan po. So primarily pwede niyang mai-pass yan sa yun po sa nakasex niya. So kailangan po mag-ingat tayo. Then at the same time, si pregnant women, yung kanyang husband nag-travel, then hindi nila alam na infected na pala asawa niya, pwede rin po siyang magkaroon ng infection or ng virus comes from the Zika. Here are the signs and symptoms of Zika virus. The usual symptoms like dengue and chikungunya, ang pinagkaiba lang po is yung red eyes or the conjunctivitis. Then mere muscle pain, joint pain, headache, rashes, and fever. Risk factors. Ito po. Living or traveling in countries where there have been outbreaks. Being in a tropical and subtropical areas. We all know na ito po yung mas mabilis na dumami ang ang mosquito kapag nandun po tayo sa mga tropical or subtropical areas. Then yung sa mga countries which is yung maraming forest, like dun sa Uganda, merong mga part ng US. So dun mas mabilis na dumami yung mga mosquito or magkaroon ng outbreak. So having unprotected sex, yun nga pong nasabi ko earlier na yun, hindi lang si mosquito bite ang pwedeng makapag-transfer ng virus, which is unprotected sex. So we have to be careful or to be sure kung sino man po yung yun nga yung yung sa partner or makaka-sex, na we have to be aware kung nag-travel ba siya sa area na merong mga sightings or outbreaks ng Zika, just to protect ourselves, especially to those pregnant women. Then early stage of pregnancy, like what I said earlier, na mas mataas yung chance na mapasa or magkaroon ng defect ang isang fetus kapag nasa early stage pa lang ng pagbubuntis ang isang babae. Diagnosis or diagnostic test na pwedeng makapag-confirm na if you have a Zika virus. For the pregnant women, ultrasound, kasi makikita po natin dito yung kung meron ng abnormality si baby, kasi makikita natin kung yun bang head niya is abnormal yung size or nasa normal pa rin naman. So the blood test, pwede niyang ma-detect because of the RNA na meron sa blood, na yung blood mo is contaminated or infected ng Zika virus. Same as the urine test. Here are the treatment, like dengue and chikungunya, wala pong vaccine ang Zika virus, no specific medicine. So ang tinitreat lang po niya is the symptoms. Like for example, the fever, the doctor will give acetaminophen or the Tylenol to reduce the fever and the pain, which is yung muscle pain, joint pain. Okay, then get plenty of rest. Drink fluids to prevent dehydration. This one is important. Make sure na wag pong magtitake ng any aspirins or non-steroidal anti-inflammatory drugs until na-rolled out na si dengue. Kasi we all know that dengue can cause bleeding. Then, if you are taking any medicine for another medical condition, like yung may mga heart disease, mga diabetic, so we have to inform our healthcare provider, especially our doctor, para po matingnan niya kung baka ma-alter yung effect ng gamot na iniinom nyo sa mga irereseta niya for Zika virus. Okay, the prevention for Zika, we have to make sure na cover yung skin natin if we are going outside, lalo na kung merong mga sightings or records na meron pong Zika virus sa area nyo or dun sa lugar na pupuntahan. Then aside from the clothing, meron tayong insect repellent na which is ila-apply dun sa area na hindi po makukover ng ating damit, just to make sure na hindi po talaga tayo makakagat ng mosquito. We have to bear in mind, pag-apply po ng insect repellent, hindi lang po once a day, lalo na kung the whole day nasa outdoor ka. You have to reapply it para at least sure talaga na hindi ka lalapitan ng lamok. Then, for our house, kailangan meron tayong screen door or sa yung window, may screen para po ma-prevent natin yung pagpasok ng lamok sa loob ng bahay. Then, if you are going to sleep outside, make sure na yun nga, mag-apply ng insect repellent or yung gumamit ng mga camping tools na merong treated siya for insect repellent. Then, this one, yung picture dito, yun, to stop the breeding or yung pagdami ng mosquito, we have to clean our houses, especially yung mga stagnant water. Yun, kailangan natin i-remove para hindi na dumami yung lamok dun sa area natin. Then for the last picture, having protected sex using condoms, especially dun sa mga may partner na nagta-travel because of work or any reasons, we have to be careful, especially kung buntis po yung partner. Kasi we all know that Zika virus can cause irreversible effect to the fetus. Kaya kailangan po maging protected. That's all. That ends my presentation for today. Our topic for next week is all about Japanese encephalitis, another disease caused by mosquito bite. So if you have any questions, clarification, and suggestion, feel free to reach out our clinic team. Thank you for your time and have a great day. Bye.